and also as a clinical ear care specialist, I specialise in the removal of earwax, infected debris and discharge from the ear canal. We have here a client who attended with bilateral fully occluding earwax, and I've started off here with the patient's left ear. The wax is a sticky, dry consistency, and there is a lot of skin adhesions here. You can see the entrance of the ear canal is quite narrow. It's almost a collapsed canal at the entrance, which is making it narrow. As we age, the cartilage, both in the ear and the nose, it loses its rigidity. So quite often, elderly people have a droopy nose, and that's because the cartilage, the scaffolding of the cartilage has lost its rigidity, and it kind of loses its shape and collapses forwards. And similarly with the ear, so the outer third of the ear canal is composed of cartilage, where the inner 2/3 is bone. And quite often with elderly clients, you do find the entrance of the ear, the cartilage has lost its rigidity, so it's collapsed upon itself. So with this particular client, the entrance is quite narrow and slit, but once you get through the outer third, the ear canal expands, and you can see here it's quite visible actually compared to the entrance. So we're a bit further in the ear now, and the ear canal has widened. You can see there on the right hand side of the image, so on the patient's posterior canal wall, the back part of the ear canal wall, there's a lot of skin, and that skin's quite fresh. You can tell by the colour. Similar to earwax, as skin ages, it oxidizes and it turns from a pale white colour into a pale yellow, and then a dark brown, and an almost blackish appearance. So there you can see what I'm doing there. I've got a suction grip and I'm just wriggling in circles, trying to loosen the wax, detach the skin from the canal wall, which I've managed to do there. There is a bit of skin now at the base of the ear canal and anteriorly, so the front part of the ear canal. And you can see I'm gently just trying to peel this. This skin is attached to the earwax itself, so in order for me to remove the wax, I will have to peel this skin layer as well. And I'm just making slow movements, peeling skin. If you imagine if you've got a bit of dead skin on your finger and you try and peel that, it can be slightly uncomfortable. So we do have to be a bit cautious. And also with skin, when you vacuum skin, you do get what we call clarinetting. So the skin, it flaps viciously within inside the suction probe, and it emits a very high frequency squeal whistle, which can be deafening not only for the patient but also for the clinical ear care specialist. So you do have to be careful. So I've managed to extract that lump of wax, which is quite medial, and I'm bringing it forwards. And you can see at the entrance, because the entrance is a bit narrower, it's collapsed. The wax is not coming out in a big mass, it's getting caught up, it's getting trapped at the entrance. So the wax is almost coming off in pieces as it arrives at the ear canal entrance. So this is another big boulder of wax, and I'm just trying to wriggle it through. I'm also using the suction probe there to just almost expand the ear canal entrance. It's almost like a crowbar effect. You're getting a crowbar to expand and retract the entrance a bit, making it wider. You can see the colour of this wax is a bit darker compared to the outer layer. So this wax has been obviously in the ear for a bit longer, and it's oxidized. And when earwax oxidizes, it turns from a pale brown colour to a darker shade. And we're almost there now. So again, little kind of gentle wriggles, little circular motions, and I'm just wriggling this through the narrow entrance. And I do think this is the last piece here. A bit of skin attached as well, and I believe that's the last piece. We enter the ear now. You can see the tympanic membrane. So the tympanic membrane is the medical term for the eardrum. A bit of soft wax coating the ear canal entrance. So I'm just very cautiously and delicately mopping up the entrance. We do have to be careful when you apply pressure to the outer part of the ear canal, the cartilage portion. You can stimulate a host of nerves, one being the Arnold's nerve, and that nerve is at the base of the ear canal. If you stimulate that, you do elicit the gag reflex and people cough. Obviously, during these COVID-19 times, the last thing we want is people sneezing or coughing, because the virus itself can be elicited by the patient through droplets, through sneezing and coughing. But the patient was okay, and I managed to mop up the entrance. We now move over to the patient's right ear, and again, similar issue. The entrance itself is quite narrow, it's quite slit, but once you enter the ear canal, it does widen, it protrudes open. The wax here is a bit dry and there is a bit more skin adhesion, so I'm just now working at the base of the ear canal, very lateral, so near the entrance, and I'm just tugging this tough layer of skin, trying to elevate it, retract it from the base of the ear canal. And once I've done that, it will help me remove the wax. The wax is no longer adhered to the canal wall. You can almost see it will kind of translate that dead skin as acting almost like a double-sided tape. One side is sticking to the ear canal, the other side sticking to the earwax. So quite often when you do remove earwax, you also do have to remove this layer of skin adhered to it and embedded to it at the same time. So this piece of wax is a bit more medial now, it's a bit deeper in the ear. It's not as soft in consistency compared to the left ear, so it's a lot drier. When wax is a bit dry, it is a bit difficult getting a suction grip, and you can see that I'm just trying to find a grip, a strong enough grip where that wax really sucks onto the tip of the suction probe. A bit of skin adhesion superiorly at the roof of the ear canal. I've managed to get a bit of a suction grip there, and you can actually see the shape of the wax. It's almost like a disc. Where I've got the suction grip, it's quite narrow, taking the shape of the ear canal entrance. And then as I remove this piece of wax will kind of, the shape of it will be obviously a cast of the deeper portion of the ear canal, which will be a bit wider. And I've just removed that there, so there's a bit more there. And you can see as we enter the ear, it does widen, it's a better view. It's just at the entrance, and quite often the ear canal entrance is probably about 5 or 6 millimeters. The endoscope diameter is 2.7 millimeters, and the suction probe itself, the Zollner suction probe in any case, is 2 millimeters. So it can be a tight squeeze getting both instruments into the ear. So you're not able to view it, but if you were watching me from outside the ear, I'm using the distal end of the endoscope, which is the tip, and as I'm entering the ear canal, I'm using that against the concha cartilage, and I'm pushing that away and stretching it like I was on the opposite ear. I'm using the endoscope almost like a crowbar. I'm stretching, widening, retracting open the ear canal, enabling more space so I can insert the Zollner suction probe. And remember, I'm holding the camera, the iClearScope, the wireless endoscope that we've developed, with my left hand, and I'm operating the suction probe with my right hand. So it does require a lot of fine motor control and hand-eye coordination between not only the eyes and the hands, but between both hands. I've managed to remove that last piece of wax. You can see a lot of dry skin at the entrance. I'm just going to mop up as much as I can there. Again, I'm trying to avoid the client coughing, eliciting the gag reflex in any way. This skin in any case will naturally now shed and migrate, and there's a bit of surface wax just at the base there and a bit of dead skin at the top. It's quite tough skin on this side. The tougher skin is normally the fresher skin. As the skin ages in the ear canal, it does become a bit looser and weaker. And then you had a lovely view of the patient's eardrum, very healthy, intact. You have a still image here of the contents of all the wax removed from both ears. You can see the different shades of brown there. You see also the paler brown, which is the fresher, more recently secreted earwax, and the darker brown, which is the oxidized earwax, which is the wax that's been in the ear for longer. I hope you enjoyed that video, everyone, and if this is the first time you're watching one of my videos on YouTube, do please subscribe, like, comment, share, and select the bell icon to be notified as and when I upload new videos. And similarly, if you're watching this on Facebook or Instagram, do follow, subscribe to my page, like, comment, share. I hope everyone's keeping well and safe, and hopefully I'll load a new video in due course. Take care, enjoy the rest of your weekend. Thanks, bye.